All right, welcome to everyone to the next webinar in our series. We started at the end of last year and we're continuing to do it. So in this series, we have three webinars on mental health topics. And so the first one, we have Stacey and Casey McKenna, who is my co-host here, is going to introduce Stacey in a minute. The format is we do some introductions, we have a presentation from our guest speaker, and we do a prize drawing at the end. Question and answers, and then a prize drawing. So with that, welcome everyone again. And Casey, it's your turn.
Okay, great. Well, with that, I would like to introduce Dr. Stacey Feuer. She is a licensed clinical health psychologist and the director of health psychology for a large medical group in the Chicago area. She has a passion for working with individuals with chronic medical illnesses as a psychologist, healthcare consultant, and a speaker. Through her work, she helps patients live healthier, more resilient lives while coping with a wide range of medical conditions. She specializes in particular in individuals living with the special challenges of rare, ultra rare, and/or genetic diseases. We are so happy to have Stacey here with us today.
Thanks, Casey. Thank you so much. And thanks to Jerry and the National Fabry Disease Foundation for having me here tonight.
And I'll add one more thing, Stacey, that Stacey and I met in the early 2000s in, I think it was in Baltimore, wasn't it?
It was in Baltimore. Yep.
Yeah. So yeah, Stacey and I have known each other for a very long time. Okay.
Thank you again for the introduction and for having me here tonight. Just going to spend a quick minute introducing myself a little further. As Casey mentioned, I am a licensed clinical health psychologist and the director of the clinical health psychology program for a pretty large medical group outside of the Chicago downtown area. And professionally, what that means is that I spend my days doing one-on-one individual psychotherapy with adults living with chronic medical conditions. And because of my background in the rare disease space, I do specialize in people with genetic and/or rare diseases, in addition to the more common medical illnesses that we know, like cancer and heart disease. So that's my professional connection. Personally, I am also a rare disease patient, which is how I briefly, I'll just share with you that for the first 10 years or so of my diagnosis, I was very, very sick. There were several years where I was not able to work. I was severely disabled. I was often bedbound, and had a very, very difficult period of time with this illness. And during that time, I really struggled to find appropriate mental health support. And when my health started to improve to the point where I thought I might be able to go back out into the working world, because of my experiences as a rare disease patient, I really wanted to try to provide for other rare disease individuals what I could not find for myself, which was mental health support that really understands what it's like to live with a chronic medical illness. And so that is how I come to be here. It's been a long journey since then, but I am pleased to talk with you some more tonight about what this looks like. So tonight we're going to be talking about the psychosocial aspects of living with rare disease. And I'm looking forward to hearing some of your questions at the end about how some of this material may pertain to your own experiences. So let's dive right in. Okay, so briefly what we're going to talk about tonight is a little bit about what the actual academic literature says about mental health and rare disease. There is a very small but important literature out there that talks about this, and I think we need to continue to talk about it and contribute to it as much as possible. We're going to talk then a little more specifically about the psychosocial impact of having a rare disease on the day-to-day living, and then a little bit about what we can start to do about that. Okay, so what does the research say? So I'm going to go through these articles a little bit quickly. I don't want to spend too much time here, but I do want to give you the understanding that there is research being done in this area that we definitely need to see more of, but what exists, is pretty good. So this is a study, a little bit of an older study, but this is one of the only studies out there that provides a kind of global description of what it's like to live with a rare disease from a mental health perspective. So this study identified 6 key areas that tend to be connected to a rare disease individual's mental state. They have to do with various healthcare problems, such as delayed diagnosis, misdiagnosis, difficulty finding appropriate care, navigating the healthcare system, something that seems to be getting worse day by day. They also talk about social and financial issues associated with rare diseases. As many of us know here, seeking care and treatments tends to be very, very expensive in the rare disease space. This is different than with more common chronic medical issues. The third condition that was identified here was the impact on family circumstances, which covers a range of things. We're going to talk about that a little bit more specifically. But essentially, patterns that exist in families, tend to be exacerbated. Both positive and negative patterns tend to be exacerbated by any kind of stressor. And having a chronic disease, and a rare chronic disease especially, can contribute to that quite a bit. They talk about the impact on friendships and leisure activities, difficulties in romantic relationships, and an overall elevated vulnerability to mental health conditions such as anxiety, depression, and trauma-related conditions. So we're going to get into all of this a little more specifically as we go forward. I just want to give a brief overview of a few of these studies. So in this study, this was a very large meta-study that looked at many other studies studying mental health and rare disease. And they looked at this a little bit differently. They looked at what are some of the consequences of living with a rare disease. And in this study, they found that the most identified consequences were physical limitations due to issues with pain, sleep, dietary restrictions, treatment restrictions, the psychological impact, which is our main focus here tonight. And also, nicely to see, they also found that there were some positive emotions associated with living with a rare disease. Things like gratefulness for treatment when it exists, appreciation for caregivers. They also looked at the social aspects of living with a rare disease. And in this study, the participants identified, difficulties in explaining to other people how you feel, what it's like to have your disease. Maybe if you have something that's not visible, trying to help people understand, when they're in pain or uncomfortable, when it may not be clear to others. The stigma that can arise around having a chronic medical illness, something that's visible or not visible, each have their own different stigma associations with those. Socially feeling different and wanting to be quote unquote normal, and just challenges in finding social support in general, especially peer support. As many of you probably already know, finding other people who have your diagnosis is really important and helpful. And with a rare disease, that is more difficult to find because there are just less of us out there and less resources. So it's an increased burden in the rare disease space. And again, experiences with healthcare, the healthcare system. And we're going to see this one come up again and again. I just add to what you've heard so far that it has been estimated that the frustrations and challenges in dealing with the healthcare system can take up as much as 50% or more of the stress that individuals with rare diseases experience. Sometimes the experiences with the healthcare system are more of a stressor than the disease itself. So I think, as we hear this over and over again, it really speaks to the idea of how much our interaction with the healthcare system impacts our rare disease experience. So along those lines, this study looks specifically at how do individuals living with rare disease experience their doctor's visits, right? Something that we've all been through. And what they found, again, not too surprisingly for those of us that live this every day, is that patients with rare diseases experience a core dilemma that we are looking to our doctors for help, but we are also often the experts in our disease. So we also sometimes have to be the teachers. And this can set up a conflict between patients and doctors. So what this study found was essentially that when the doctor is able to acknowledge that patients with rare diseases need to play a more active role in their doctor's visits, and that it is going to look different, things will go smoother. So, this is something that speaks to the education that, sorry, I keep moving this thing around, that the education that the doctors need to be pursuing in order to provide us with the best care possible. Okay, so in this study, this is a two-part study, so we're just gonna get that really quick. So this was a really interesting study. This was a very small study, but what I found fascinating about this was they asked people living with rare diseases, is the fact that your disease rare and an especially difficult part of your difficulties in having it? So is the rare part especially problematic? And what was really surprising to me when I read this was that the answer was no, with a big caveat. Participants in this study said, no, having a rare disease isn't necessarily the problem, as long as the care that I've received has been morally well done. And that's the part that really stuck out for me. You don't hear a lot of studies that talk about morals in this space. And basically what they were saying was, what does that look like that their care was morally well done? Well, it looks like being diagnosed in a proper time frame. It looks like having doctors whose attitudes are supportive and are transparent, right? Doctors that are open to asking questions and acknowledging their knowledge limits about rare diseases, doctors that are able to discuss diagnosis and prognosis in a way that is, respectful and transparent, doctors who provide not just information, but actual concrete guidance, not just here's what is happening, but what are some of the specific individual things that you're dealing with that I can help you navigate. And then things like insufficient treatment and feeling isolated, through the healthcare experience. So when these factors are not present or are more on the positive end of the spectrum, at least in this study, the people living with the rare diseases said being rare didn't feel like so much of a problem in and of itself. And just some numbers here. So there's a number of studies out there about depression and anxiety statistics. This is kind of a good average. So generally speaking, in people living with rare diseases, about 42% report moderate or severe depression, which is very high compared to the general population. And it's even high when compared to people living with other more common chronic medical diseases like cancer, for example. And they also reported about 23% reported moderate or severe anxiety. And this doesn't mean 42 plus 23% because depression and anxiety often occur together. So these numbers are kind of overlapping in that way. So we see that there are higher mental health needs on the two biggest diagnoses, depression and anxiety, in the rare disease population as compared to other chronic medical illnesses in the general population. It's pretty clear that the rare disease community needs more support. Okay, so if we start to get into these themes a little bit more specifically, what then does the psychosocial impact look like for us day to day? So some of these issues we've already mentioned a little bit, and we're going to hear them as we go on. Having a rare disease can feel very isolating. It's difficult to find appropriate medical care. It can be difficult to find other people that have what we have for that peer support. When you have something like breast cancer, and I certainly do not mean to suggest that having breast cancer is easy in any way, but when you have breast cancer, you don't have to go 5 miles around you to find many doctors that have heard of your disease, many treatment options, many support group options, right? It's different. When you have a rare disease, the only doctor that may treat what you have may live in another state or another country. There may not be a treatment, or there may be one. There's all these other kinds of barriers that can get in the way, which can contribute to feeling very lonely and isolated. The decreased resources for social support that we mentioned, lack of medical information in general, that can just make the rare disease experience feel more uncertain than other illnesses. Increased contact with a medical profession that is not familiar with your diagnosis. So as we talked about a moment ago, all those difficult experiences that we have with medical profession is exacerbated by the fact that we may have to go more often than our friends and family. So we have that experience more than we would otherwise. When the disease is genetic, there can be a specific kind of guilt or shame that comes along with having a genetic disease in our family. It can feel like we have bad genes or faulty genes. There can be guilt and or shame for having passed it along to children. So these are very specific mental health issues that don't necessarily come up in a disease that's not genetic. And then there's just increased overall stress for many rare disease folks because of the increased financial burdens that occur with rare diseases, for example, the cost of the orphan drug medications. So we talked about stigma a little bit. Let's talk about it a little bit more. There's a lot of different ways that stigma can affect your day. It may come in the form of being underdiagnosed or misdiagnosed by a doctor, being kind of stigmatized for having symptoms and they're not being able to explain it or treat it, and so you become kind of a problem patient or seen as a problem patient. This is something that can occur with any medical condition, but especially that a doctor has never heard of. They may, in fact, consider somebody as exaggerating or faking or being a hypochondriac. This can also happen with friends and family and coworkers as well. Especially when you have something that's not visible. There can be of who is the person with the illness as inconsistent or lazy, because you may present differently at different times. Limitations, but they don't, so they may see us as active over here but not active over here, and it may be hard for them to understand. There's often need to kind of prove that you're sick with an invisible illness, which kind of sucks, because the last thing most of us want to do is spend more time talking about our health and our illness, but we may have to do that in order to get the accommodations that we need. it can feel like our insides and our outsides don't necessarily match. We may look fine and healthy on the outside, but be in pain or tired or have lots of other things going on the inside. And that mismatch can make it difficult to navigate the world sometimes. Having an invisible illness may make it more difficult to get handicap parking passes, may make it more difficult to get disability income because it's not so obvious to the people that we're trying to do that with. Okay, so these are some of the ways that my own patients have expressed some of these challenges to me in therapy. So one of my patients is a 25-year-old female with MS, and she expressed to me recently the fear of, what if I never feel well enough to have a normal life? My whole life is managing my symptoms. Another patient that I've seen recently, who's a 29-year-old male who has a rare undiagnosed eye disease. We have a lot of folks in the rare disease space that are undiagnosed. They don't even have a name for their illness. And he simply said, my doctors all think I'm making this up because nobody can figure out what he has. So they send him to me because they think he might, having anxiety issues or making it up. Another patient, 62-year-old female with an arteriovenous malformation in the brain that I have seen post-surgery, shared with me that now that she has experienced a rare disease, being told something else is rare is not as reassuring anymore because she's already had something rare happen. So that doesn't make her feel better when somebody says it's rare anymore. And the last quote here is from a 56-year-old female patient who has multiple medical diagnoses, including rare diagnoses, has talked about feeling like a freak. She says, why do I deserve this? What did I do to deserve this? I sometimes feel like an alien or a freak because of my diagnosis. So these are just some of the ways that these concepts are felt by individual people on a day-to-day basis. Okay, so when we talk about the psychosocial impact, let's break it down to some specific areas. How does having a rare disease impact our ability to have a job or to pursue our education? So it depends on whether you're a child or an adult, right? So if you are a child with a rare disease, right, you may experience disruption in being able to go to school, not being able to attend on a regular basis or unpredictably. This might be because of the illness symptoms themselves. It might be due to having medical appointments that get in the way of school. It might also be because navigating the physical, social, or emotional environment of the school is challenging for that child in particular. For adults that are looking to continue their education, college age and up, having a rare disease, chronic illness may interfere with their ability to do that. It might also impact that person's caregiver or partner because they may need to take time away from their educational or work to help care for the person they love. So it can impact, more than one person in that family system. When you have a chronic medical illness, a rare disease, you may have more from work, more latenesses to work, and maybe more disengaged while at work. Because, for example, let's say you have to contact your doctor's office or your insurance company, and they're open from 9 to 5, right, on a weekday, and you are at work during that time. So you have no choice but to engage in these activities in order to get your health needs met. But it makes it difficult to engage in one's job when we have to do that. And it can make it difficult to plan for the future, right? To just take a new job willy-nilly, right? We can't do that. We have lots of different things to consider. What's their insurance plan? How will I feel? What medical obligations do I have coming up in the future in the next few years that I have to think about in order to plan for my job or schooling goals and plans. Okay. So this can also have a big impact on our family relationships. There may be, an incredible amount of increased stress on the nuclear family, so the immediate family, especially those living with or having the most direct and constant contact with the person with the diagnosis. So there may be more arguing and tensions, more difficulty understanding each other's feelings and where they're coming from around the illness. There may be less ability to spend time together that's not focused on the illness itself. So if a lot of your time as family is spent talking about health issues, making doctor's appointments, maybe being in scary situations, being in the hospital, being in treatment rooms, that's all taking away from time together where we're not thinking about our illness, right? So that can have an impact on the quality of that time that's spent together. With extended family that's not around as much and maybe, doesn't experience the day-to-day impact of the diagnosis, there can be a difficulty for those folks to really understand, what it's like to live with that diagnosis on a day-to-day basis. So it may be hard for them to kind of, empathize or know how to help, you as their loved one, because they don't necessarily understand quite as much. So it can feel like family is not reaching out, or like they don't care, or that they don't understand, especially the extended family. And then if there's more than one child in the family, if the affected individual is a child and there's siblings, it can be difficult to balance the needs of the healthy siblings with the affected siblings. This can be especially true in the case of Fabry disease, right, where more than one family member is often affected. And so you have multiple needs that need to be met of the people that have the diagnosis and the people that do not have the diagnosis. And so along these lines, in a romantic relationship, something that doesn't get talked about in mental health nearly enough is the impact of a chronic medical disease and rare disease diagnosis on sexuality and intimacy. There are some issues that may get in the way of this, physical issues such as pain or mobility issues, side effects of medications, self-esteem, body image changes, issues that have come on because of the diagnosis. There are some really damaging myths out there about people who have health issues, illnesses and disabilities, and sexuality, right? So it can feel like a challenge to overcome some of those myths that people who are sick and disabled, or both, aren't also sexual beings and don't also need intimacy of different kinds. And then there can be this issue with the genetic disease of, understanding that with a genetic disease, that is how it would get passed on in the family if one was still in the family planning phase. Sorry, the slides are kind of moving on their own. I apologize. And so that whole thought process can also kind of interfere and get in the way sometimes of being intimate with our partners, because we have this bigger issue in the back of our heads about possibly, passing on the diagnosis to, to future generations. Okay, we've talked a little bit about the financial stressors that can happen with a rare disease, especially. So again, rare disease treatments are very expensive. Having to see doctors and travel for those appointments, and maybe go to conferences where that may be the only place you can get the information you need. These are all expensive. And finances are a big stressor for most people when you have health issues on top of it that are causing those financial issues. It can increase that distress quite a bit. So we have treatment costs, we have transportation to medical appointments, insurance costs, costs of any kind of care that's not covered under the traditional healthcare system. So if you need massages on a regular basis, acupuncture, anything that's not considered traditional medicine is probably coming out of your pocket. So that adds an additional cost. Any environmental adaptations that you need to your home or your workplace or your vehicle can be expensive and may not be covered or fully covered by insurance. There may be loss of income in addition to these things of either the person affected by the illness and or the partner and family members as well. There may be an impact on your income status if you need to go on disability or if there's a workman's comp situation related to this in some way. And as I mentioned before, in many studies, individuals living with rare diseases identify financial issues and navigating the healthcare system as equally or sometimes more stressful than the illness itself. It may be difficult to have social life because of the physical symptoms, because of how much time and energy it takes to manage all the medical needs on top of the other necessary day-to-day tasks that may leave little or no time or energy or bandwidth for a social life, which can lead to that increased feeling of isolation. There may be financial reasons why we can't afford to, go out with friends like we used to. And then psychosocially speaking, it may be difficult to feel like we have to sometimes explain or defend if we need to rest on that outing, or we need some sort of accommodation when we're out with friends. A lot of people, don't necessarily want to have to deal with that, so they just don't go. There may be a concern of being a burden on friends and family if we see them socially. And how people that don't know us may respond, to any kind of especially visible disability that we may have. And related to that, leisure time, it kind of feels like, well, what's the big deal if we have less leisure time? Leisure time is so important. In psychology, we talk about the 3/8 rule. Generally speaking, we should try to have 8 hours of work kind of activity, where we're busy and engaged, 8 hours of rest where we're awake but kind of resting, and 8 hours of sleep. So I can't see anybody else, but I've asked this question in previous conferences and webinars before. I'm going to guess that most of us do not achieve that. I certainly struggle with that as well. But if most of your leisure time, your waking, resting time is taken up by all of these tasks that we're talking about, or is taken up by not feeling well, then it starts to really throw that balance off and can contribute to things like anxiety and depression and overall distress. And we really do have to talk about the impact of COVID-19 in the last few years, and specifically how it's impacted the rare disease community. So this was a study that was done in 2021, so 1 year into the pandemic, on how was the pandemic impacting rare disease care. And they identified 3 key areas where it had a really big, unfortunately, negative impact. They found that the pandemic contributed greatly to diagnostic delays. So people were not able to get their diagnosis maybe as early or as soon as they could have because of the pandemic, which may have delayed treatment and care. The pandemic also made already existing problems in healthcare that much worse, which again, I know we probably all feel on a day-to-day basis. Specifically, this study found that 83% so 8 out of 10 people living with a rare disease experienced delays or cancellations in diagnostic testing, transfusion treatments, surgeries, any kind of scans or films, and routine appointments, 8 out of 10. I was definitely one of those people. I'm guessing some of you all were as well. Related to our mental health topic, 2/3 of those people stated that these disruptions negatively impacted their well-being, with 1/3 reporting that these disruptions were definitely or probably life-threatening. So you can imagine how much anxiety and trauma that can bring up for us when we know we need this care and it feels like life or death at times and we weren't able to access it. And this last point here at the bottom, the pandemic basically exposed how fragile the rare disease drug development process is. And for people living with rare diseases, research, clinical trials, things of that nature are often the only way that rare diseases get treatments. So having those slowed down or stopped during the pandemic has really had an impact. And so I share this part to also demonstrate that some of our mental health challenges are related to the individual challenges that we're dealing with because of our illness. Some of them are more systemic and because of what's happening in the systems around us. And when they are happening together, it just increases the chances that we're going to experience mental health challenges such as depression and anxiety, and even sometimes trauma. Okay, how are we doing on time? Pretty good. I think I'm almost there. So now that I've effectively depressed everybody in this webinar and brought everybody down with all of these negatives, what can we do? Because there is quite a lot that we can do. And so this definition of health, this was created by the World Health Organization all the way back in 1948. It remains the gold standard of health, and there's more detail to this, but this is the basic gist. So the World Health Organization defines health as a state of complete physical, mental, and social well-being, and not just the absence of disease or infirmity. And I love this so much because it really speaks to the idea that being healthy, mentally, physically, and emotionally healthy and socially isn't just about getting from bad to neutral. It's really about getting from neutral to good. And in my practice, this is what I spend a lot of time on, is how can we not just address the problems themselves and get to neutral, but how can we actually try to find some positive experiences, maybe even some happiness and meaning through our illness experience. Okay, so we're not going to be able to go into these in a lot of detail, but some coping strategies that can be really important in dealing with a rare disease on a day-to-day basis are things like learning to build resilience. I'm going to talk about this a little more in the next slide, so we'll leave it there for the moment. Increasing peer support. Things like the National Fabry Disease Foundation, peer support organizations, meetings, conferences, webinars, social media outlets, anything that we can do to connect, not just to support networks, that are out there in general, but specifically to support networks that are related to our diagnosis. That is the key. That is what is different about rare diseases especially. It's even more important to find that peer support because of the other conditions that lead to isolation that we talked about. Another coping strategy is learning how to increase your idea of what self-care is, what it means, and what well-being means. And we're going to talk about that a little bit more specifically in another slide as well. This one I really love. Giving yourself permission to develop realistic expectations. When we have any kind of chronic medical illness, but especially a rare disease where we have these extra challenges, it can be really difficult to not have expectations that set us up for failure. And it can be really difficult to set more realistic expectations without feeling like we're giving up or we're being weak or lazy somehow in doing that. So an example of this might be the amount of activities you have planned in your week, right? If you feel like being busy is how you show strength, right? I'm a strong person because I can maintain this very busy schedule. Then it's going to be really hard to let that go a little bit in order to have more realistic expectations that don't set you up for, kind of needing a week of rest because you've burnt out, because you've been so busy, maybe more busy than you needed to be. So realistic expectations is really important. Learning how to rely on what I call realistic optimism versus toxic positivity. So toxic positivity is this idea that, you've gone to somebody for support and they say things like, well, I know this other person who has this other thing and they've managed to figure it out and they're doing really well. Or you go to somebody for support and they tell you about their problems, or they tell you just to, get a good night's sleep, or, the sun will come up in the morning, and it doesn't really feel very validating to your experience, right? It kind of can feel like they don't really believe you or really understand where you're coming from, because they're just kind of positive without any relation to what you're actually experiencing. If we contrast that with realistic optimism, what that means is that as a person living with an illness, it's okay to have hopes and goals and have positive thoughts for the future, but we also want to temper that with a realistic understanding of our actual abilities. And that's a healthy way, to move forward. We don't necessarily need to deny that things are difficult in order to be positive. And then for our caregivers, our parents, our partners, our children, friends, anybody that is in the caregiving role, they also, if any of those folks are on this call, you also need your own support. There is therapy out there for caregivers as well. It's really important that you recognize that it's okay if you are also struggling, and it's okay for you also to seek support, and that it is available and can be helpful. Okay, so I promised that we'd talk about resilience a little more specifically. What I want to say about this is that resilience is often talked about as if we're just supposed to keep going and going and going and going until we fall down. That is not resilience. Resilience is not how we keep going even when we're running out of energy and running out of ability. That's a fast track to burnout. Resilience is about how we recover, not how we persist. So think about your car, right? If you were to keep running your car, even though the gas tank is going towards empty and the engine is starting to smoke and the tires are starting to bald, and we just keep driving that car until we can't, the car's going to stop working or explode or something, right? We would never do that to our car, but we do it to ourselves all the time because we think resilience means running the car until the wheels fall off. And in fact, the research shows that that is exactly the opposite of true. If you want to be resilient in the face of your illness, learning how to balance activity and rest is an extremely important part of that. So if you want to build resilience, you can do that by learning how to strategically stop. There's a lot more we could say about that, but I know we don't have a ton of time, so I'm going to leave it there for the moment. And then I also promised we'd come back to self-care. And so I think self-care gets this kind of very fluffy reputation, right? That it's, it's self-help books in the Barnes & Noble aisle. I'm dating myself, and bubble baths. But self-care it is sometimes those things, but it's so much more than bubble baths and wine, although I highly recommend those. Self-care has a lot of different dimensions. Self-care can be about physical needs, social needs, environmental, financial, spiritual, emotional, intellectual. There's all these different areas that we can take care of ourselves in different ways. So it might look like, in the physical realm, it might look like listening to our bodies and taking a rest when we need it. In the environmental realm, that might look like making sure that our home is as comfortable as possible. It might look like paying our bills. How is that self-care? Well, when we take care of our responsibilities, it takes extra stress off of us. And that is a type of self-care. It may be spiritual. It may be connecting with your spiritual beliefs and making sure that you make time for those. So there's a lot of different ways that we can engage in self-care. And most importantly, understanding that self-care is a skill and resilience is a skill. It's not something that we're either born with or we're not. We can learn how to increase these in our life in order to have our mental health be in a more balanced place. Okay, so having said all of that, I'd like you to think about, for the rest of our time tonight, and maybe when we're done here, how has your rare disease, how has your diagnosis of Fabry disease impacted you in some of the ways that we've been talking about? How has it impacted you psychologically, socially, financially, romantically, sexually, your leisure time, your work and school worlds? How has it impacted you? If you can break it down a little bit in some of those ways, not only may it help us understand how our rare disease is affecting our mental health, but it may also help us identify strategies. If we, instead of it just feeling like one big cloud of bad, if we can identify some specifics, then we can identify specific strategies maybe to try to address them. So to wrap up, I'm going to leave us with this quote. This is from Dr. Kleiman, who was one of the first MDs to write about living with chronic medical illness and what that's like from a doctor's perspective. And he said, successful coping is not something that can be achieved outright once and for all. Patients and families, and also practitioners, struggle to cope on a daily basis. Coping looks like coping well on Tuesday, badly on Wednesday morning, better on Wednesday afternoon, maybe better still on Thursday, worse again on Friday, and so on. To meet one day with defeat and the next with hope, the great adversity of chronic illness with its many losses and threats is a moral lesson that can keep even the most indocile of us from despair. So what I love about this quote is that he's really validating, and this quote is like 20, 30 years old. He's really validating that coping with chronic medical illness, and this is especially true with rare diseases, it never looks the same day to day. We have ups and downs, and it may change from day to day or even within the same day. And that may not be normal out there, but it is normal for us. So we can, rest assured that what we are experiencing, we're not crazy, you're not alone. It is normal in the context of living with a chronic medical disease and a rare diagnosis. So with that, I will end that there and open up the floor to any questions or comments.
Thank you so much, Stacey.
Hi, my name's Sierra Hunt, and I had a couple of questions. One is there a list of mental health providers who offer telehealth appointments for those living with a rare disease or Fabry disease? I'm just wondering what's the best way to find, a therapist that would be most helpful for this condition.
Yeah. Excellent question. There is not one list, but clinical health psychologists are where you want to go. So clinical health psychologists like myself have done all of their training and all of their work experience in medical settings. So for example, I did all of my doctoral training in healthcare clinics, hospitals, the Cleveland Clinic in Florida, Loyola Medical University in Chicago. So they're going to be the psychologists that actually work with people with medical issues. General psychologists don't tend to do that. So when you look for a clinical health psychologist, Psychology Today is one place that you could look for something like that. You can go in there, you can plug in your zip code and some keywords. What I want you to know though is a lot of therapists and psychologists list that they work with illness. A clinical health psychologist will list that as the only thing they do, or one of maybe two things that they do. A clinical health psychologist will say that they have worked only in medical settings. So that's going to be your best bet. Yeah, and Psychology Today is, probably the easiest kind of list that you could go to search for somebody like that.
Thank you so much.
You're welcome.
I have a comment about that.
Yeah.
So this is Jerry.
Hey, Jerry.
We, 2 webinars from now, we have our Family Assistance Program speaking, KGA. And what KGA will tell you in their presentation that is if you use our Family Assistance Program, KGA will help you find a counselor wherever you're at.
Oh, wow.
And then they will, if you want counseling, the National Fabry Disease Foundation pays for about 3 sessions with the counselor that you choose. And then it's up to you what happens after that. But we have a great system in place as one of the ways you can find a counselor. So if you're interested in that, 2 presentations from now, we have a presentation from KGA.
Thank you so much. And Stacey, thank you for such a fantastic presentation. Really well done, and I appreciate all the information.
My pleasure. Thank you.
Stacey, do we have any other questions?
Yeah, we have a question in the chat.
Okay.
Do you recommend adults and children with rare disease to talk to a therapist on a regular basis?
I mean, in general, I think everybody should talk to a therapist on a regular basis. Everybody's different. Not everybody needs that, but I do think, especially if you are, still looking for a diagnosis or experiencing a new diagnosis, especially in the beginning, it can be really helpful to talk to a therapist while that's going on, because they can help you process your feelings in real time, right? So while you're actually going through it, they can help you with the fear and the uncertainty and the anxiety and all the different things that you're experiencing. I think it can be really helpful to do it, especially at the beginning. Because my practice is all individuals with chronic medical illness, I also see people that, they've been seeing them for, years now, because frankly, their illnesses are still there, right? They don't go away. So I have patients I've been seeing for 4 or 5 years. They don't have any acute issues going on. There's nothing, no emergency right now, no new diagnosis, but sometimes they feel well, sometimes they don't. That's still their life. So they still need help as well. So it can be helpful if you have a new diagnosis, an emergency to see a therapist either.
I have a follow-up question for you, which is not from the chat, but I'm wondering, how would some adults on this call talk to their children about possibly the child starting therapy?
So I think you want to keep it age appropriate, right? Every age has a different level of being able to understand what's going on. So for younger kids, maybe helping them understand that, we found you another person, a really nice person, who you can talk to when you are feeling sad, when you're feeling scared, when you're feeling happy. And we think it's important for you to have as many people as possible to talk about these things with. So we found this person to help you with that. When kids are a little bit older, I would say, starting to get into like preteen and above, I think it's appropriate to talk more specifically about things like depression, anxiety that they may be experiencing, and identify it and name it, and talk specifically about how therapists, work on those things with you, um, as partners, right?
Thank you. This person's child talks to a social worker at school about things. Do you think that is sufficient?
Probably not. And the reason I say that is because most social workers are not trained specifically in medical issues. Nothing against social workers. I know and work with many, many social workers of different degree levels. But unless they are a medical social worker, which means that they are a social worker that was trained in medical environments, then they're probably not going to have the specific knowledge about the health part of it. So it may be helpful in general, but if they need more specific support, I would recommend either a medically trained social worker or a doctoral level health psychologist.
Thank you so much, Stacey.
Great. Sorry, I didn't mean to sound abrupt to everyone, because we can take another question or two if you have them, but we don't want to keep people that need to get out at 8. So is there any last quick questions before we move on to the drawing? Are there? Okay. Well, thank you very much. Stacey, thank you so much. Casey, thank you for helping to manage the chats, and for Brittany for keeping.
Thank you so much. Very interesting and helpful.
For her webinar support. So now, if everyone, what word are we going to use, Casey, to put in the chat box for the prize drawing? And the prize drawing is for primary attendees, which means people with Fabry disease, family members, or caregivers. And so what would we like to put in the chat?
How about build resilience?
Okay, build. So if everyone in that category of primary attendees would put the word build in the chat box, we'll do our prize drawing. Okay, Ross, you are the winner of the $50 prize drawing tonight, so congratulations. And we will get that prize in the mail to you. So any last comments before we depart and enjoy the rest of our evening? All right, well, thank you all so much again. We appreciate you being here. We are going to continue this, a couple more sessions on mental health and on related resources, and then we'll see what topics we can come up with next. If you have ideas for topics that we haven't addressed yet in our first, I think this is the 5th webinar so far, then let us know, and we'll try to get those on the books. So thank you all. Good night, everyone.